in some industries, using external data is very important, right? And my part of my background is actually in life sciences, but on the manufacturing side. And obviously, life sciences manufacturers almost live and die by IMS data in the United States, right? But on the healthcare side, right, you've got everything there, so it's sort of a question of bringing it together.
I will say though, during the pandemic, we started, and really as we start to look at the impact this has had on who's receiving care, because Seattle Children's, we're really trying to reach as many patients and families as we can. And so demographics data now starting to become useful in trying to understand who are we reaching and who are we not reaching. So as a result of the pandemic, who was coming in and now who's not coming in, right? So that we can start to proactively go out and find out, why are these kiddos, because it's important for them to get their care.
Yeah.
And are they not coming in because they can't afford it? Are they not coming in because their parents can't support it? And so what can we do to help sort of improve that? So demographics has been helpful to understand kind of how the disease has progressed and how it's impacted our patients and families. And so for like situational awareness outside the walls of Seattle Children's, it can be useful for that.
Yeah, no, that makes sense. So maybe sticking with that theme, and I did want to get your sense of so it's a known kind of hairy issue in healthcare, the problem of data interoperability, and obviously there's PII, there's heavy regulatory framework. I think compared to at least some healthcare providers, it sounds like you were relatively well positioned in terms of maturity and capabilities to respond. But are there a couple of areas in which, was poor data interoperability a big impact in your pandemic response? Or conversely, were there a couple of things where, and it was literally a year ago today, right? You're like, thank God we did X, Y, Z, in the last 2 years. Otherwise, we'd really be in trouble now. So I'm really interested in what, in terms of, kind of addressing baseline challenges, but also creating capabilities that are flexible to respond to this kind of black swan event. What's your read on that a year out?
Yeah, it's a really good question. I've thought about this quite a bit. So, 5 years ago when we started on this journey, we data was all over the place, right? So basically state of the art for us at Seattle Children's was hire an analyst, give them Tableau, and set them loose. And
I've heard of that. Yeah.
And by the way, this is not unique to healthcare, and it's not unique to Children's. It's unique to everybody.
Yeah.
And actually, when I did the assessment, when I came in, I told the leadership team this is a good thing, right? To have 40 different groups all doing their own thing, having their own reporting database, because the organization obviously is at a point where they're starting to appreciate the value of what they get from it. The problem is there is no single version of truth.
Yeah.
And so as we've been, our approach has been very results driven. And so we're every time we do any work, anytime we go after a project or whatever, it really has some impact on the business. But as part of that, one of the things we've done is we've continued to, a little bit at a time with each implementation, improve on creating a single version of the truth. So by the time the pandemic rolled around, we actually had that in place. So we didn't have to worry about creating a single version of the truth because we had it. Really, we could now just focus on then what do we need as an organization to create situational awareness internally, right? To help us understand, what patients have it, how did they get it, who's getting the training they need in order to do things properly in response. How's the workforce doing? There are all these things that we're able to sort of quickly build on because that single version of truth was already in place. And as an organization, we had zero appreciation for it. We were so focused on solving the problem related to the pandemic. They didn't realize that the reason things were going so fast was because the foundation was there.
Yeah, no, that's key. And if you're able to share this, when the single source of truth, I infer from what you said that you kind of built that separately. So it's outside your core operational systems, but it's connected to them and connects the data across them.
It is, yeah. So it started out, we call it Zeus. It started out as we leveraged Netezza as sort of the platform, so our relational database. Then as time went on and we started bringing in larger sets of data and had more data science work that we were doing, we basically paired that up with a Hadoop environment, so our, kind of your traditional data lake. And we've also built out a high performance compute component. And those three things actually all work together as our data platform for the organization. And so there's just one semantic model really for all three of those components.